Have you ever had a love-hate relationship with someone or something? Well, in counselor words, we call that being ambivalent about something, which is fancy for saying you have mixed feelings. Ambivalence is when you have two very different, lots of times contradictory feelings about the same subject. And anyone with a substance use disorder is going to be having some ambivalent feelings. A skilled treatment provider will know how to help someone through those ambivalent feelings so that they can look at all the pros and the cons of the decisions that they're making or the behaviors that they're engaging in. If your loved one is only telling you or their counselor all the positive reasons why they need to change, then they're just telling you everything that you want to hear, which means you're only getting half of the story, which means you're never going to get anywhere. So you've got to prepare yourself for being able to hear the pros and the cons of whatever choices or behavior that this person is making. You can take that information and use it to help shape their environment, which, remember, helps to shape their external motivation, which then in turn leads to shaping their internal motivation. Remember, motivation is interactive and it's controlled by the environment. It changes all the time, and you can exert a lot of control over the environment, which means you can exert a lot of control over motivation. Now, unfortunately, a lot of community support groups, some 12-step groups, and even a lot of treatment providers and counselors really still don't understand the most effective way to treat people with a substance abuse problem. They go about it in what I call the old school, tear you down and then build you up kind of way, and it's all based on confrontation. Confrontation is the absolute number one most effective way to kill motivation. I know it's hard to believe because you think, well, counselors and treatment centers, they still do it that way. Yes, that's true. And I guess it works on a few types of people, or maybe in a few certain situations. I used to have this boss and he used to say, even a broken clock is right twice a day, but it doesn't mean it's the most effective way to get the job done. If you treat people with respect and you give them options, their resistance will decrease, which basically means that wall is going to start to come down and they're going to be more honest with you. And the more they feel like they can tell you the truth about their drinking or using or why it's helpful for them. For me as a counselor, the more someone can tell me the reasons why they want to drink, the pros and the cons, the better, because that's all the information that I need to help this person make a change. Sometimes even in 12-step meetings, people get the impression that they definitely can't express any ambivalence. I've seen it happen before. Someone that says, well, I don't know if I really want to quit drinking and my wife, she's just a jerk or whatever it is. And people in the 12-step meeting might respond by saying something like, well, come back when you're ready, or you just hadn't hit your bottom yet. And so what they're essentially saying is you've got to have some internal motivation to make this work, which might be sort of true, but isn't very helpful in creating that internal motivation. Depends on the meeting really, because all meetings are different, but I have seen people say they feel like they can't talk about a relapse, or they feel shamed, or they feel embarrassed. And sometimes that's just the person's own feeling. It doesn't have anything to do with the meeting, like they're not being told that or treated badly, they just feel bad on the inside. But sometimes I've seen it outright negatively responded to if someone talks about the fact that they're still drinking off and on or still using off and on. So make sure that you get your loved one in the right place, especially if they're in the earlier stages of change, that can handle dealing with this ambivalence, because it's a key, important, central issue to getting people to shift into that active stage of change, which is where the magic happens.